Hi, I'm Barbara Fleming. I'm an internal medicine physician with a PhD in nutrition, and I have a passion for sharing health information to help us achieve our best health. What I'd like to talk to you today is about living longer with cancer with certain very common, very inexpensive, widely used drugs. I'll share some studies with you. I want to share first a really amazing study that got me interested in this topic, and it appeared in the media about 2 weeks ago. This was a study that was done at MD Anderson Cancer Center, and that's really one of the premier cancer centers in the world. Investigators there studied patients with advanced ovarian cancer and looked at patients using beta blockers, and beta blockers are a very common drug used in blood pressure control, and those who weren't. For patients using a specific beta blocker, their median survival was 7.9 years, compared to 3.5 years for patients with advanced ovarian cancer who were not using a beta blocker. Pretty amazing. And I wondered, is this just an isolated study, or maybe there are more studies on this cancer and this drug or other common drugs and common cancers? So I went to the literature. I went to the National Library of Medicine database. It's called PubMed. And I looked at studies really over the past several years, and I was fairly amazed at what I found. There are lots of studies on, in particular, 4 drugs: aspirin, statins used for cholesterol control, metformin used commonly in diabetes, and beta blockers used for blood pressure control. And there are pretty positive findings with those 4 drugs in some common cancers as well, and primarily the solid tumor cancers, breast cancer, prostate cancer, melanoma, ovarian cancer, and some others. So again, this was not an isolated study, and the findings are pretty impressive. I want to alert you to one really well done review. It was done by Dr. Michelle Holmes at Harvard and Dr. Wendy Chin at Dana-Farber. They looked at 4 of these very common, well, more than 4 actually, of these very common drugs in patients with breast cancer. Now, their findings, when they reviewed the literature, were quite interesting. I don't want to misquote and I don't want to overstate, so I'd like to share verbatim a conclusion that they reached after their review of studies. These authors concluded, and I quote, "Substantial scientific evidence supports the hypothesis that some of these common and relatively safe drugs may reduce breast cancer mortality among those with the disease by an amount that rivals the mortality reduction gained by currently used therapies. In particular, the evidence is strongest for aspirin, approximately a 50% reduction, for statins, approximately a 25% reduction, and metformin, approximately a 50% reduction." End quote. Again, pretty impressive findings. Effective drugs, cheap drugs, used for years very widely, so we know the safety profile of these. As good as the usually more expensive and often more toxic traditional therapies, amazing. And patients don't know about this. Now, what's wrong with this picture? Actually, I would say, and it's just my opinion, quite a bit, but I think there's an explanation for it. In medicine, physicians very often wait for the randomized controlled trial, and that's a particular kind of study that actually is very good at determining cause and effect. In this case, though, we have observational study after observational study showing a positive effect of these drugs. And in addition, there are studies that show what the mechanism for the effect of the drugs most likely is. So many pieces of the picture are in place. The problem is these are cheap, they're generic. It's not in the drug company's best interest financially to spend $10, $15 million on these trials. So government or private agencies will have to step up to the plate to fund these trials. We don't have them yet. It'll be a while. 5 years, 10 years, who knows? And while these are not drugs that have been shown to cure cancer, they are drugs that have been shown to extend life of patients with cancer. if the RCTs back these up, wouldn't it be sad that patients have lost the potential to have those additional life years while potentially waiting to see if in fact there are cures for those cancers? So I think this is quite compelling information. The need for randomized controlled trials is more than evident. And I wanted to share this with you because I don't think patients know it. And this may be interesting information for you to talk with your physician about. If you think this is interesting and you'd like to explore it a little bit more, check out a blog I've done. It's www.yourbesthealthconnection.com. I've listed studies, I've linked to studies, so you actually can look at least at abstracts in all of these cases. So hopefully this is helpful to you, and if it is, let me know. Here's to your best health.